Controversial topics may or may not be at the forefront of your mind as you practice responding to common med school interview questions. Some students shudder about being peppered with tough questions regarding things like the Affordable Care Act, whereas others ignore the possibility entirely. Regardless, you don't want to be caught off guard by questions you haven't prepared for, especially the kind of questions that you might not be able to comfortably answer even in everyday conversation. In this video, we'll talk about how to prepare for interview questions about controversial topics and how to respond to them in a way that impresses adcoms without ruffling any feathers. Then we'll look at an example of a common med school interview question about a controversial topic and break it down so you know how to approach it. And finally, we'll do a close analysis of two different responses to that question, a weak response and a strong response, so you can be confident that nothing will surprise you on interview day. Before we get started, be sure to like this video and subscribe to our channel so you can be the first to see our new resources with all the latest updates and guidance on med school admissions. So, what's controversial about medical school? And why would interviewers want to raise controversial topics with candidates? Well, your response helps them assess you for several important qualities in a doctor, including ethical values, thoughtfulness and reflectiveness, decision-making and reasoning skills, and communication skills. They want to know that you're able to think critically and come to a decision based on the information you're presented with. They want to know that you have a rational process for coming to conclusions rather than just acting on impulse or going with your gut, which can often leave room for bias and oversight. And they're also interested in the actual substance of your answer. These questions typically revolve around current, relevant, hot-button issues in the world of medicine. So although there may not be a single correct answer for many of the questions, there are certainly answers that could raise some red flags. But how can you know what they want to hear? What if your response offends an interviewer because it doesn't align with their own opinions? While it's hard to totally eliminate that risk, the vast majority of interviewers will be pleased to hear any answer that aligns with basic medical ethics, as long as you can explain why you hold the views that you do. Now, let's take a look at a couple of common interview questions related to controversial topics, and then we'll go over some best practices for giving a response that will impress adcoms. How would the adoption of universal healthcare affect your desire to be a physician? How do you feel about stem cell research? What are your thoughts on mandatory vaccines for healthcare workers? These questions span a wide range of topics, and they require some close reflection to determine how to best respond. However, your responses to each question should all follow a similar structure. First, you need to demonstrate a clear understanding of the issue the question raises. For example, take a moment to give a brief explanation of what stem cell research or universal healthcare are. Next, explain your own perspective on the issue. Notice that all three of these example questions ask you to describe how you feel or what your thoughts are about a topic. Depending on how the question is worded, you may not actually be asked to choose a side, and it's okay to admit if you're still in the process of forming an opinion, as long as you can clearly articulate your thought process. Still, we recommend that you avoid remaining completely neutral. After all, doctors need to be decisive on a daily basis, especially in time-sensitive, high-pressure situations, so it can be helpful to show adcoms that you know how to consider all angles of an issue and draw your own conclusion. Just make sure that you let the main principles of medical ethics, beneficence, non-maleficence, respect for patient autonomy, and justice inform the stance you choose. Whichever position you take, it's also important to convey an open mind and a willingness to grow. Take some time to lay out the opposing sides of the issue and acknowledge what factors might be motivating the people on both sides. Perhaps most importantly, make sure your response doesn't dehumanize or vilify any group, including political parties. If you're asked about a highly politicized issue, focus on the people who are most directly impacted by that issue. Remember that you're talking about real people's lives, and as a future doctor, it may not be your job to create policies, but it definitely will be your job to care for the people who are most directly impacted by them. As you wrap up your response, take a moment to briefly reiterate your own personal perspective on the issue so adcoms are left with a clear impression of your views. If you want to see how this structure can be applied to virtually any interview question about controversial topics, check out our med school interview question bank to browse hundreds of common questions, full-length answers to each, and detailed analyses for a variety of traditional and MMI question categories. With that, let's take a look at two different responses to this controversial topic question. We'll start with a weak response, and then we'll contrast it with a strong response so you can get a clear sense of the best strategies for impressing your interviewers. I think our country is long overdue on adopting a universal healthcare system. Not only does it make more sense to have a centralized system that will be easier to navigate for everyone, but it also would finally make healthcare accessible to the people who are most in need of it. Throughout all of my clinical and service experiences, I've witnessed the struggles that low-income, unemployed, or chronically ill patients go through to receive care. They shouldn't have to let their needs go unmet just because they're down on their luck or they weren't born into as much privilege as the next person. Based on those past experiences, I realized that as a future doctor, I really want to prioritize health equity and do my best to provide the same quality of care to all of my patients. Patients deserve to be treated equally, no matter what, and universal healthcare would finally level the playing field. A system that eliminates the current barriers of access to healthcare would allow me to do that, so I'd be really happy to build my career within that system. Critics of universal healthcare often seem to prioritize profits over patients. They worry that their salaries would take a hit if the current system was uprooted and replaced, and so they don't even allow themselves to consider the alternative. They come up with excuses for why the systems that work in other countries could never be adapted to the United States, because we're too big or our economy is structured differently. But personally, I think that's a really narrow-minded view of things, and I hope we can move past that mindset within my lifetime. This response falls short from the start by failing to demonstrate the applicant's understanding of universal healthcare. Of course, the interviewer will know what universal healthcare is, but they can't be sure that you know unless you show them, so it's important to establish that from the start. The applicant jumps straight into sharing their opinion about universal healthcare, but you'll notice that they never actually quite answer the question. They state that the US should switch to universal healthcare, but they never really explain how the change would impact their desire to be a physician. After sharing their own views, they should try to demonstrate their understanding of opposing views, but instead, they actually come off a bit harsh. They make broad generalizations about critics of universal healthcare that could be construed as closed-minded. In the worst case scenario, their assumptions could even offend an interviewer who happens to be a critic of universal healthcare. Now let's examine a strong response to this question and discuss what makes it so much more effective. Universal healthcare is a system that would provide everyone in the country with free access to healthcare. In this system, the free market of health insurance would be abolished, and instead the federal government would become the sole vendor. The main benefit of the system is that it guarantees healthcare for all, regardless of socioeconomic status, employment status, or pre-existing conditions. I can really see the appeal of this system because throughout all of my clinical and service experiences, I've witnessed the struggles that patients who have low income, are unemployed, or experiencing chronic illness go through to receive care. Some of the patients I served checked themselves out of the hospital early because the bills were putting them into debt. Others told me stories about how, even though they're insured now, their symptoms went unchecked for years because they couldn't afford preventative care. Based on those past experiences, I realized that as a future doctor, I really want to prioritize health equity and do my best to provide the same quality of care to all my patients. A system that eliminates the current barriers of access to healthcare would allow me to do that, so I'd be happy to build my career within that system. I realize that universal healthcare has its disadvantages too, though. I can understand why some doctors in the US are wary of it and why it might deter some people from wanting to become doctors. It would initially be complicated to implement here due to all the stakeholders and corporations embedded within our current system. I've also read that it could initially lower physician salaries because of the lack of competition and that patients could sometimes have to wait a bit longer to receive care. Still, waiting a bit longer to receive care is better than never being able to afford care at all, like so many of the patients I've encountered. So in my eyes, the benefits outweigh the disadvantages. I would like to see universal healthcare become a reality in the United States during my lifetime, but either way, my priority will remain the same, providing the best possible quality of care to every patient I encounter. In this response, the applicant adheres closely to our recommended structure. They start by clearly demonstrating that they understand what universal healthcare is. Then they describe their own stance on the issue the question raises. They provide a straightforward response to the question by stating that the adoption of universal healthcare would actually only motivate them more to become a physician because they believe it would help them align their work more closely with their personal and professional values. They even give specific examples of how their own past interactions with patients have informed that viewpoint. Next, they take a lot of time to demonstrate their understanding of opposing viewpoints. Rather than just making assumptions about the other side, they show a degree of empathy. Instead of questioning the character or values of the people they disagree with, they point out a few legitimate reasons why those people might be worried about transitioning to universal healthcare. In their final few sentences, they turn their response back to their own perspective, reiterating their response loud and clear. They express that they would be excited to get to work as a doctor within a universal healthcare system, but their plans for a career in medicine will remain the same regardless. Controversial topics can be difficult to navigate in any context, but especially in the middle of your med school interviews. That's why it's so important to get familiar with the various subjects that might come up and learn the strategies for building a confident, well-balanced response. As you consider how you're going to express your views in your response, remember to let your core values, including the AAMC pre-med competencies for entering medical students, guide you. As long as your values align with theirs and you express a willingness to reconsider your views as new information or experiences come along, then you'll be well on your way to making a great impression in your interview. In addition to the example question and response we've shared in this video, be sure to also check out our med school interview question bank, where you can review hundreds of common questions, full-length answers to each, and detailed analyses for various traditional and MMI question categories, including cultural competency or curveball questions. Best of luck.